greetings from InUni UK. Thank you so much for joining our webinar today. My name is Begina Weatherill and I'm the Director of Recruitment within InUni UK division, a company of global university systems overseeing international students recruitment for a number of our UK partner universities. Today, I'm extremely excited to talk about our premium partner university, beautiful Canterbury Christchurch University, located in the Garden of England in Kent. And today we will be specifically covering one of the programs which is available in May 2025. So we still accept applications for May 2025 intake, and it's Masters in Global Public Health. And I'm excited to be joined by my colleagues from the university. So we have Elisabetta Corva, who is a course director for Global Public Health. Thank you so much for joining us, Elisabetta. We have Richard Venner, who is International Business Development Manager at CCCU. And I'm also joined by my colleague from InUni marketing team, Sukanya, who is helping us to run this webinar. Just a few housekeeping rules before we start. You're all on mute. If you'd like to ask any questions whatsoever, feel free to pop them into the Q&A section. So that's Q&A section rather than chat section. And we will take them from there at the very end of the webinar. So I really hope you can stay with us till the end of this webinar. The webinar is also being recorded, and the recording will be shared with you later on in case if you miss anything. Other than that, sit back and enjoy. And I really hope you enjoy this webinar and find it useful and inspiring. I guess it's over to you, Elisabetta. The stage is yours. Thank you.
Thank you, Dagina. Thank you. Hello, everyone. Good morning, everyone. Good afternoon. I don't know what is the right thing to say. Anyway, depending on where you are. But anyway, welcome. I'm Elisabetta Corvo. I am the course director for the Global Public Health MSc. And I'm going to present a bit what is the MSc about and what is our program for your own knowledge and understanding. So as Dagina says, any question maybe later. At the moment, you can, you can have a look at the presentation. MSc Global Public Health. Here is the structure of where we are. So basically, we are within the Faculty of Medicine, Health and Social Care. We have this two schools. Now, this is going to change a bit, but doesn't matter. What is important is that you are with us, Public Health and Health Promotion team. We are the the Public Health team, and we have the MSc in Global Public Health. So we are here, and what we aim with this program aims to create an environment for interdisciplinary and interprofessional learning. That is one of the keywords you have to keep in your mind, because the interdisciplinarity is one of the key points of our MSc. So embedding research and scholarship, enhancing the engagement with public health and wider health industry stakeholders, and integrating the development of employability skills thorough. So why is interdisciplinary and professional learning important? Because in the master, the students are coming from very different backgrounds. So that is one of the key points of our master. From different background, you can find your own place into public health. Because as we say all the time, this is a mantra, our mantra in public health is everybody's business. You can see public health, you can look at public health from a number of corner and aspect. So it's not just open to one background, but to many, many backgrounds. So what are the entry requirements? I don't know if you can see this, but anyway, entry requirements is a relevant first degree. You have to have a first degree of course, international student, if you are an international student, need to meet the requirements of any international student coming in the UK. I was an international student, so I was in this section of the student. If English was or is not your first language, as wasn't my first language, you require IELTS overall score of 6 with no element below 5 to 5. I suppose you are familiar with this concept. Anyway, if you don't know what IELTS is, please check your understanding. It's a test to enter in the UK university. There are some exceptions. If the IELTS requirement different, it will be specified in the course pages. So there is some exception, but not for our MSc. So IELTS, requirement for international student, and the first degree. This is the three things that you need to have to come here to study with us, okay? To study and to learn with us, okay? So here we have some of the former students. I hope this is going to be working. Let's finger cross, finger cross, finger cross. Let's play this. It's working. I'm so happy.
We can see it, Elizabeth, but I can't personally hear it. I'm not sure if it's the same for you, Richard.
You cannot hear?
No, I can't hear it. I can see
Yeah,
though.
can't hear it either.
I'm really sorry. Anyway, we can go ahead and maybe we will sort it out later on. So
Sure,
let's
and
be
we can share the
practical.
link. We can always share the link later on. Yeah.
I'm sorry.
That's all right.
Practicality, Italian practicality, because I am from Italy. So as you can easily understand from my lovely accent. So let's go ahead and on the next slide, which is one of the most important slides. Okay, so here there is the structure of the MSc. You have the compulsory modules and the optional modules, okay? Compulsory modules means that they are mandatory. You have to do it. There is no way to escape, okay? So the first is global health and SDG, so global health and sustainable development goals. This module gave you an overview about global health and the SDG, why are important, what we can do to improve the health, what are the surrounding elements that have an impact on health. Evidence-based global public health, which is basically research methods, where you're going to learn the basics of research, how to do research, what are the ethical implications of research, and all elements surrounding research in public health. Then we have essential of global epidemiology. Epidemiology is the foundative discipline of public health. So of course we need to study epidemiology. Essential is because are the pillars of epidemiology. Now I stop 1 second just because these 3 modules are the 3 modules you are going to see in the first trimester, okay, of your study. So on the first trimester of your study, global health and sustainable development goals, evidence-based, and essential of global epidemiology. These are 3 modules, so you don't have any choice in the first module that is going between June, July, and August, so basically during the summer. Okay, then you have the second trimester when you're going to have another mandatory module. We are going to see this better in another slide. But anyway, health promotion, thinking globally, acting locally. So public health, is looking at elements and issues that are global, as from the title of the master. So poverty is global, is a global aspect that have an impact on health. But of course, poverty can be seen in a very different way depending on where you are. If you are in a specific country, if you are in Europe, if you are in Asia, it depends. So thinking globally, think about the global thing, but acting locally, because we have to tailor the intervention in the local setting. So second trimester, you are going to do either two of these modules listed: environment, health, and as sustainable development, global healthcare system, migration, culture, and health, work-based learning, or you can select a module from any other postgraduate program. Usually what I suggest to the student is to stick with our program, and we normally work on the main three listed. So environment, global healthcare system, which I call system, and migration, culture, and health. Two of them are running every year. So either environmental global healthcare system, or global healthcare system and migration, or migration environment, depending. And these are optional modules, but then you have to do it. Every module is 20 credits, okay? So 20, 20, 20, 20. Now, maths is not my cup of tea, but you can easily understand that 6 modules times 20 is 120 credits. So during the first 2 modules, you are going to do all these, sorry, the first 2 trimesters, bear with me, you are going to do these modules. And then between the second trimester and the third trimester, you are going to do the global public health research projects, which are 60 credits. So at the end, you are going to have 190 credits to get the full master. So let's look at here. So I kind of anticipate this, but forgive me. So here you can see trimester 1, global evidence as essential. Trimester 2, health promotion, with this compulsory, as was clear from this slide. And then we have either. Sorry. And then you have the 60 credit global public health research project that you are going to do with the supervision of one of my colleagues or myself, depending on the allocation. So this is what is, just to give you an idea. So summer trimester 1, September, Christmas, so December trimester 2, and last trimester is January, is this moment. So January, end of January up to April. Okay, just to give you an overview of what is going on. Okay, this is what is the master about, and this is how is structured. Okay. Now let's go to good things. This award we have once a year. The David Stills Memorial Prize is going to a postgrad student within the Faculty of Health and Wellbeing on completion of a master degree dissertation or an MPhil PhD thesis in recognition of a valuable contribution to research in the field of health education, health promotion, or public health. Let's give me a moment of immodesty. I don't know if this word exists, but I'm not modest. I win this prize, so it is open to you to win this prize if you do a very good dissertation. And this is very good because you can add this to your CV say, I was the winner. So I hope you can also take into account this. Now, going ahead, careers. Now, as I said, public health is everybody business. This was the starting point of all my presentation. And the fact that we need to think about public health as something that actually we can look at from a very wide number of point of view. So these are just some examples. Childcare worker, refugees, so all the migration sector is open to public health. All lifestyle, so smoking cessation, alcohol abuse is again our business as a public health. Housing is also an important slice of our environment. Environmental health technician, COVID community coordinator. We also had experience of this during COVID outbreak. Community and community development is also a very, very, very important aspect of public health. How community develop and how we can improve the community health. Health promotion worker. Mental health. Mental health is another part of our scope. Screening and immunization, so all what is about vaccination as well. Care workers. Then we have also the part about statistics, so data analysis. So statistical assistant also is part, if you're very keen on epidemiology, for instance, on demography, on epidemiology, etc. And many others, to be honest. You can find the right corner, the right point of view. My suggestion is to really make the most of the course where you can actually look at what is your interest. It's something that often happens with students. They develop the interest while they are doing the master. So you don't know maybe at the start what you are interested in. Listen to all the lectures, all the papers we are going to ask you to read, all the information we are going to give you. You start to develop an interest on something that you didn't think about it before, or you enhance, if you want, if you like, what you are already interested in. So you are maybe a person that have already an interest on something, and you develop this part. This is why we speak about interdisciplinarity, because we actually think about how much we can learn each other. I always learn something from the student, because we have different students as a background. We have different students in terms of the country where they come from. I am myself Italian, so it's very good to have exchange on how it works in your country, or this is different, why is different. Let's analyze why it's different. The team is really rich of different discipline, interest. I forgot also physical activity. This is another important point. Couple of my colleagues are focused on physical activity. So this is another focus that you can think about it. Mental health, all what is about food, environment, community development, arts and health. I also forgot speak about arts and health. That is my point, is one of the things I am interested in. So here, career pathway, again, housing department, community development and community work, drugs and alcohol work, health life advisor, charities. I work in charity for many, many years. So in my case was about before children and then older people. So there is a massive opportunity also on this. Workplace health, again, another thing that I forgot. Good that my slide remind me how many things we can do. Justice system, probation service, prison work, physical and sexual health, health protection, local authorities and councils. So there is plenty of opportunity after public health, especially if you have also a background that supports you on this. I hope I have explained you nearly everything. Oh, one thing that is important, maybe is good to let you know. Let's go back to trimester. For each module, you're going to have assessment. Forgot this point. The assessment are mixture. So there are writing assessment, there are all assessment, essay, posters, developing artifacts. So there is plenty of opportunity to playing with our own strengths. So somebody is maybe more keen in developing an artifact, or somebody is more keen in a pure essay. Somebody is better in oral presentation. So we have kind of different assignments. So for each module, we have a couple of assignments to do. You will be supported on those, but there is also a lot of independent study. So we need to work together to give you the best student experience. Now I finish really. So I leave to my colleagues, and I hope you are going to have a lot of questions, and especially I hope to be able to actually answer. Okay. Thank you for your attention.
Thank you so much, Elizabeth. Really useful information, and I'm sure our attendees found it helpful as well. Just a reminder for everyone that the GAS Gateway portal is already open for May intake applications. If you do have students who already have all the financial documents ready for them to be able to apply for CAS letter and visa application as well, please submit as soon as possible, so our team on the ground can then conduct consultations, process your applications to the next stage, and you would be able to then receive CAS from CCCU in February itself. From the current CAS allocation, because as you know, in the UK, universities obviously have CAS allocation per each year, and they normally apply for their CAS allocation annually. So this is the time of the year when the university does submit an application to the UKVI for new CAS allocation. The university still has plenty of CAS available, which we can utilize in February itself if you submit your application quickly enough. But we're still accepting applications till later anyway. It's just if your financial documents are not ready yet, then obviously you will be able to apply for your CAS at a later stage, perhaps. This program is also available for September intake in case if you are still in studies, in education, so maybe you're completing your bachelor's degree back home. So you're also welcome to start submitting applications for September intake. GAS Gateway portal is already open as well for you to be able to file your student's application for both May intake and September intake as well for pretty much all the programs that are available at CCCU. Okay, let's see if we do have any questions. And just a reminder to everyone, international scholarship is also available for May intake. Tuition fees remain the same. In fact, exciting news, the university is not increasing tuition fee, neither for May intake nor for September. They stay flat at £15,500, which is great. And international scholarship of £1,500 obviously brings the tuition fees down to £14,000. Just a reminder again, initial deposit for CAS letter is only £5,000. So once you've received your unconditional offer letter issued by the university and you have your unique CCU student ID, which is specified within the offer letter, you can then proceed with your payment of your deposit and booking your pre-CAS interview via the university portal. If any technical issues, again, reach out to my team on the ground. They would be happy to support and arrange that pre-CAS interview for you. If you did already pass the interview for January intake, but perhaps you were not able to receive CAS letter within the established deadlines, you can simply defer to May intake, and you will not need to take another pre-CAS interview if it was the same course. So if you apply for Global Public Health initially and now you're simply deferring the intake, but you are still applying for the same program, whether it's May intake or September intake, normally you are okay with your pre-CAS interview. But if you are changing the course, you will need to provide a new statement of purpose outlining as to why you're applying for your chosen program. And obviously, then you will need to book your pre-CAS interview once a new unconditional offer letter has been issued. I guess these are the main points to mention. All three programs available. So for May intake, yes, that's correct, Alicia. Good question. We do have 3 programs available. So last week we were talking about MBA and MSc International Business. So that's within CCU Business School. Both are available for May intake, and Global Public Health is the 3rd program that is available for May intake. So yes, correct, we do have 3 programs available for May intake. They start on 27th of May. So the sooner you submit your application, the better, because like I mentioned, the university can already issue classes for May intake for you, and that will also help you to submit your visa application at the soonest to avoid any potential delays with the UKVI Home Office. Any further questions you have, please feel free to pop them within the Q&A section. Elisabetta, I know MSc Global Public Health is really popular program. Would you be able to advise to us in terms of the class size? I know it probably depends on the intake, but just to kind of give us an idea, and also what sort of like nationality mix is present at the university for this specific course?
I am here. I have all these points that I forgot. Okay, yes, we had different numbers, I have to say. 40, 60, 70 is the average. We had, in the past, even a class of 100, but anyway, we are providing seminar groups. So we have lecture and seminars for some module, for the majority, I would say. So you have also the opportunity to have smaller groups or big groups. Normally, usually the lecture is with everyone, and then we break the groups in 2 or 3 depending on the numbers. In terms of nationality, there is a mixture. Okay, in the past we had a split between Africa and Asia, really nearly a split, 50%, 50%. Now we have a bit more Asian student. They come from Pakistan, Bangladesh, India, Sri Lanka. Now I'm going totally on the top of my head. So there is a mixture anyway, and then there is me. And so yeah, there is a mixture. Group size can be big, but then they are broken in a seminar.
Excellent. And how often do students normally need to attend tuition, so the classes? How often do they actually need to be on campus?
They usually need to be on campus. Okay, we have usually one kind of welcome week, the week before of the lectures. So, for instance, in this case, in January, for the January intake that just started, the lectures started this Monday, and the welcome week was the week before. The welcome week is a couple of days, basically, when we gave the student information. I totally understand that not always is easy to come 1 week before. So the majority of students arrive later. I arrive when they actually started the lectures. This is a really important point. The welcome week is useful because I don't know if this word exists, but you acclimate, you come to, you a bit understand how you visit the campus, you understand where are the rooms, just, to visit before. You see how it works in England, etc., etc. But anyway, starting from the first week, which is, if I'm not wrong, the first week of June, but I have to check the calendar, to be honest with you, is going to be the best.
Perfect. Thank you. And just a reminder to everyone, we do encourage students to obviously book the university accommodation where possible. It's a lively and it's a really nice place to be in Canterbury. It's one of the safest cities in the UK. It's very much walkable, so you don't need to worry about public transport or driving. And if you book the university accommodation, it's also quite affordable as well. Richard, would you like to elaborate a little bit more on accommodation?
Sorry, may I add something?
Oh, sure.
I don't drive in England because I'm afraid on the opposite side. So
I know the feeling. I'm also a very nervous driver.
So I live in Canterbury without a car since nearly 10 years, and it's perfectly doable. So just to add to your very good point, but just to give you a specific experience, everything is close. Public transport works very well. So there is, from this side, I can witness that it's really, as you said, it's very small city. Sorry,
and
sorry, Richard.
No problem. No problem.
Kind of get the best of both worlds, isn't it? Like even if you don't drive, I guess you can easily access the beach. And there are shops and everything is around as well. There are museums, art galleries. But if you want that feeling of a big city, London is only 1 hour away, which is by train. So yeah, I guess you're right, Elizabeth. It's a very good point. You don't actually have to drive if you don't want to.
I think it's an interesting cultural point, isn't it, as well? Because many international students, when they arrive, they're quite surprised that you can walk everywhere, because Canterbury, it's a city. You can see in Dagina's background the beautiful cathedral. It's a historic city, but it's quite small, so everything is easily walkable. Dagina, I think you captured perfectly the location there. An hour from London, 20 minutes from the coast and from the beach. Plenty of shops and cafes in Canterbury as well. And then obviously in my background, you can see Verena Holmes, which is our new £80 million STEM building. I guess, Elisabetta, many of the lectures are in Verena Holmes for Global Public.
There are lectures on Verena Holmes. There are lectures actually in all campus, but we do, because it's mainly for health, health and surrounding that building. So we are doing lectures there. there are also a lot of opportunities to have access to computers there. So we also do lectures that when we do practical activities, etc.
I think one thing that I love about Verena Holmes, and I'm sure our students do as well, is the collaborative learning that can go on in the lecture theatres, because they're collaborative lecture theatres, aren't they? They're not just fixed rows of seats, but they're sort of positioned so that students can talk and discuss, which must be wonderful as a student and also wonderful as a teacher as well.
Yeah, well, yeah, we have this opportunity to share you know, a lot of comments and discussion. And as I said, it's good to have different nationality and different background, interprofessional background. I think this is one of the most interesting thing for all of us. My background is not health as well. So I am always very keen to underline the fact that I personally don't have a first degree in health. But because public health is so open, I could find my own space.
That's great to know. Thank you, Elisabetta. And I think that leads to one of the questions I can see here. What is the perfect background or ideal background, or what's the requirement in terms of the student's background to apply for this program?
I have to say that we don't have a specific requirement. We speak about a relevant degree. Now, because we are, for instance, in my case, my first degree is in jurisprudence, law, to make it simple. So from a human rights pathway. So that was my starting point, and I was interested in the rights in terms of health and well-being. So this was, we had the majority, many students come from, of course, a health background, any health background, so nursing, physio, pharmacist, sorry, I'm going by heart, doctors, of course, physician, I mean, physio, then what I said also, biochemistry, some students as well. Some students come from law, and like me, some students come from economics. So there is, I won't say that there is a perfect specific, that it should be relevant. And it should be also, this is very, very important, that you are open to learn. That is the main point. You are open to learn how you can use your background from a public health point of view. Because, you know, public health is also, just to give you an example, waste management. So engineer, chemical, all these aspects is also covered. So you can find really your corner, and also you can develop a new interest. That is the main point. Because I came with an idea, and then during the time I slightly changed because I learned more about public health.
That's really good to know. Thank you, Elisabetta. And obviously, great thing for students coming to study in the UK. They can actually do part-time jobs during their studies, so 20 hours during studies during term time, and then full-time during holidays. But also, once they've graduated, they can apply for a 2 years graduate route visa if they would like to gain some experience in the UK post-graduation. From your experience, Elisabetta, what sort of jobs do students or do graduates get into? Or even like if they would like to maybe take some internship or part-time job related to what they're studying?
We had, okay, I have to be honest, I don't know exactly the answer of that, but I can tell you that because I do the reference for many of them, during the time, so I'm not speaking after, after we had students, just to give you an idea, that are now research assistant. We had some student that become a lecturer. Some student that is trying to back to their background. So physio, top of my head, because not everyone stay in contact with me. Wrong thing. But so I have some news about them. During the time, teaching assistant, I know. In nursing homes, I know. Some other things about something connected with NHS, but I don't remember what, in all honesty. So a bit of mixture. Some students also work in local shops, which is a very good to improve their English also.
Yeah, agreed. The great communication skills. I remember when I was international student, I think it's a great chance for you to make some friends, improve your communication skills if you take up a part-time job, even if it's not necessarily related to your studies.
Exactly.
And that's how you kind of build your confidence in a new
build
environment
your confidence
as well.
And also enter, which is I think very important, in the British culture. So you're not detached, because it happens to foreign students like I was, that you tend to stay with Italians, in my case, because of course it's easier to speak, etc. But you have to try to detach as much as you can and get in the British culture, understand, improve your communication skills, that then improve also your understanding in lecture. It's not just about communication, is more in the oral presentation, in the writing. So to try to detach a bit from your nation friends and go a bit.
I guess it's difficult to detach from Italians. The food is too nice.
But you have to, watching TV. I remember I watch a lot of TV too, Anyway.
Perfect. All right. That's great to know. Thank you. And I think you mentioned a really good point about nursing homes and care homes, because there are plenty of those in the UK. So it's a great chance for students to either gain part-time, maybe jobs during studies, or even get into full employment once they've graduated. It's a good industry to get into. Okay, thank you. All right, sorry, going back to accommodation, Richard, would you like to elaborate maybe on accommodation options and what sort of fees?
Yeah, of course. Of course, Digini. Yeah, so we mentioned that Canterbury is a fairly small city. Everything is within easy walking distance. So we've got a range of different student accommodation. In terms of pricing starts from £120 per week up to around £200 per week. So much more affordable than many other destinations in the UK, including London. Canterbury really is a very, very affordable destination, and it's so, as we mentioned before, it's so student friendly as well. In terms of locations as well, all of the student accommodation are within easy walking distance of our campus. There's actually a really nice accommodation building right behind our award-winning library, Augustine House. So you can literally be from your room into the library within a couple of minutes. So it's absolutely perfect.
Amazing. Gives you more time to sleep, I guess, in the morning.
Exactly.
Which is great, and get ready for your lectures. Okay, let's see what other questions we have received. Okay, just a reminder, I can see a few questions about tuition fees, deposit, enrollment fees as well. So the total tuition fee is £15,500, and then international scholarship is awarded to all international students. So you don't need to submit an application for a scholarship separately. You will receive an offer where scholarship will be specified as long as you are an international student. The initial deposit would be £5,000, which is for you to secure your place at CCU and also to apply for your CAS letter. Now, outstanding tuition fees of £9,000 would need to be demonstrated on your bank account alongside living cost, and they would need to be maintained for 28 consecutive days for you to be able to apply for your CAS and for your visa as well. Once you've secured your visa, you can either decide to pay your outstanding tuition fees in full, so that's £9,000, which would be great so that you don't have to worry about your fees and just concentrate on your studies and adapting to your life in Canterbury, or you can pay in installments if it's more convenient. So the first installment expected from you prior to enrollment would be £4,500. So that means in total you would pay £9,500 prior to commencing your studies, and then the next installment you can cover after the first term. Okay, hopefully that answers your question. How many installments? So that's 2 installments in total. So in terms of academic background, so as Elisabetta mentioned, it's quite flexible. So we will take your case, obviously, on a case-by-case basis. Please ensure if you do have a background which is not necessarily health-related, do elaborate in your personal statement as to why you're applying for this specific program, how it's going to help you with your career in future as well. So that would help admissions and academics to make a full assessment of your application. And I've already answered the question on the minimum deposit for CAS letters, so that's £5,000, and the rest can be split in installments. So just a reminder, once again, if you still have applications for May intake, you can submit them via GAS Gateway if you are our educational agency partner. If you are a student, obviously do reach out to your educational advisor and they would be able to support. If you already provided your application and you received your initial conditional offer letter issued by InUni admissions team on behalf of the university, please ensure you arrange your outstanding documents at the soonest. As well as book a consultation session with my team on the ground. So that would help you also to prepare for your pre-CAS interview with the university. If you have done that, we will then take your case further to the next stage of unconditional offer letter. Once you've received your unconditional offer letter, please ensure you arrange your CAS deposit and book your pre-CAS interview in case if you haven't done so yet. The university is already conducting interviews. It's a very quick interview, but it's really important that you attend it. You normally are given one attempt only. So ensure you follow the right time. It's normally specified within your interview invite and it's as per UK time. So please don't get confused. It's not as per your local time, it's as per UK time. And ensure you attend the pre-CAS interview from a laptop rather than using mobile phone, because we did face some technical issues sometimes when it was conducted over the mobile phone and not all students were able to actually join, unfortunately. If you've passed your pre-CAS interview, congratulations. Please proceed to the next stage. If you've paid your deposit, we will just need to check if it's been allocated. And if it has, then you will need to start submitting your CAS request. So once that option is activated within CCU Students Portal, you can then provide all necessary documents, including financial documents as well. And once that's been submitted, the university will issue your CAS letter. And they can already issue CAS letter. As you know, in the UK, the universities can issue CAS letter 6 months prior to the start date of the course. So the sooner you provide those documents, the better. It will allow you plenty of time to receive your CAS, to receive your visa as well, arrange your accommodation, ideally in Canterbury, and then obviously book your flights and arrive. You can arrive in the UK 1 month prior to the start date of the course if you would like to do a bit of exploring, which is a nice time of the year, I guess. If you're going to study in May, then April is a lovely time to explore the UK. And then you will start your studies end of May. Okay, do you accept government-sponsored documents? I think it's more related to compliance. Unfortunately, we don't have compliance team present today, but it depends what sort of government-sponsored documents you're referring to. So in some countries, students are providing educational loans documents that can be accepted. If your student perhaps secured a some sort of sponsorship by their local government, please provide the relevant documents that can be looked into. I know some governments do provide scholarships, full scholarships even. So yeah, that would be assessed by the compliance team once that's provided to us. Can students apply for jobs in the public sector, so government sector, public sector, after the program, or do they need to clear any specific exams? That's a really good question, actually. Elisabetta, what's your experience? So you mentioned NHS. Would students be able to, I'm sure it depends obviously on the job itself, but the students need to secure any additional exams or qualifications on top of the Masters of Global Public Health to be able to
I think
apply for
so,
those
but
jobs?
I'm not sure, to be honest. I think so. I think they have to do some kind, I don't know, translation of their degree if they want to work. If you think about the NHS, I think about nursing and physician, and I don't know really because I'm not personally involved in that. So I'm a bit, I don't know, Richard, if you know anything, please let me know.
I think it just depends, as you said, Elisabetta, on the job role and the kind of jobs that they're applying for. Some jobs may require additional layers of qualifications, but I'm sure that many wouldn't. And I think the Masters in Global Public Health would be the perfect sort of qualification to equip them to work in the NHS, for example, in many different roles. What do you think, Elisabetta?
I don't want to say anything that I, I I honestly don't know. For charity, I don't see the problem, in all honesty. For university, I don't see the problem. I don't know about specific roles in the NHS, and I don't want to give any fake hope. I don't want to give information that are not correct because I don't know really. Okay, so but the students who work in the university, as far as I remember, they didn't tell me that they did anything more than their degree and the master.
Okay, I guess we can take this question away and maybe just double check with the relevant teams. But do rest assured that the university also has a great career services team who supports students throughout their studies, whether it's to improve their CV, to improve their interview preparation as well, and to customize perhaps their job applications, as well as providing a list of opportunities they have for students to apply, whether it's part-time jobs, internships, or full-time employment as well. The university, just a reminder again, the university was ranked #1 for employability. Obviously it does show that they really care about your future career, and they do try their best to provide support along the way. And you mentioned also, Elisabetta, some students had jobs as teaching assistant, and then obviously they can progress further if they decide to go obviously down that route. Would they need any research? So would they need to then start maybe PhD if they would like to do anything with teaching? Or
of course, in terms of further development, this is another, actually I forgot to say, if you want to keep in the academic side. So for instance, some students I know are going ahead, not about teaching, to be honest, about something else. So they are going ahead with PhD. So they, after the master, they apply for PhD in other university, in this university. So I know somebody is looking for progressing the research side or like I did, for instance. So this is also something that is happening. So it really depends on the desire and on the development during the master, because during the master you understand a bit more what you like to do. Because if at the end of the research method, evidence-based module, you say, oh my God, I want to be a researcher, then you go start to say, okay, I want to do the research. I want to do a specific research as a research final project, and then I want to build from there my future as academic. This is something that some students decide to do. Some students are more practical. They want to go to job directly.
Yeah, absolutely. Okay, perfect. I think we've covered all the questions, and like I mentioned earlier, we will be sharing a recording and the presentation later on as well. Thank you so much once again, Elisabetta, and thank you, Richard and Sukanya, for this webinar. And yes, if you are our partner, please don't forget to submit your students' applications at the soonest, as well as outstanding documents, and arrange consultations, precast interviews, and the rest. If you are a student planning to study at CCC soon, we look forward to welcoming you at Canterbury. Thank you so much, and stay tuned for our webinars to come. Thank you. Bye-bye. Have a good